Well, I'm Oni Idigbe. I work with the Nigerian Institute for Medical Research in Lagos. And in the institute, I work as the coordinator of research planning and management. Yes, well, I joined the institute in 1980, and I grew up within the system and became the director general in 2000 to 2008. And then I stepped down and then continued working in the institute as the coordinator for research and management. And incidentally, I was one of the foundation members of IANPHI. I attended the very first meeting in Bellagio, where the idea of setting up a global body for public health institutes was mooted. And it started from there and gradually developed into a very big organization. I remember we were about 10 or 12 people who were there, but today, IANPHI has grown so big that it has over 100 member institutions across over 80 countries of the world. Well, it's very great. IANPHI has impacted, greatly on public health institutes in the world. They have helped to develop capacities of public health institutes. They have helped to, establish public health institutes in countries where they were none initially. And they have not only infrastructural capacity, they've helped to develop human capacity. I remember in the initial stages, they had types of grants, the short, the medium, and the long-term grants. The short-term grants was for capacity development for young scientists. The medium-term grants was for infrastructural development in various institutions. And it's true that NIMR was able to establish a molecular biology lab in the Institute for Diagnosis of Multi-Drug Resistant TB. And through these medium-term grants, a number of other capacities were developed in various institutions. Then they have the long-term grants that will help establish public health institutes in countries that didn't have public health institutes. I remember the clear case of Guinea-Bissau, that started trying to put together a public health institute. And today, Guinea-Bissau is one of the big, examples of what IANPHI can do to impact on public health globally. It has a great value for national public health institutes. Our observation is that most often, scientists grow within the system, and sooner or later they find themselves as leaders, but they don't have the background, the skills, to perform optimally as leaders. And this initiative by IANPHI in collaboration with the Swedish government to develop, African scientists and give them some leadership skills is great, because it will help them improve on the administrative skills when they get to the senior cadre of management, or when they become the heads of the institution. They can now effectively combine their scientific work with their management and administrative work. So I think it's quite a good initiative, and I wish that IANPHI can sustain it. We can all work together to see how we can get some more funding to sustain it. We just got the first cohort of scientists that have been trained in Africa, and we're looking forward that more cohorts will come in on board, because it will be benefit to the African Public Health Institutes. Well, the future is great, very, very great. I can see, for every annual meeting, more and more members coming on board. I was astounded, in Morocco last year, to see as many as 10 members, in new institutions coming to be members. And it has been the same practice right from 2006, when IANPHI was officially inaugurated. For every annual meeting, more and more institutions want to become members. So I'm sure at that rate, sooner or later, IANPHI will be a big global institution, global outfit. And the impact on, improving global health is enormous. It's enormous. Serving as a big umbrella to bring in public health institutes together to share ideas, to share experiences, and to share best practices to improve global health.